So it's not just the big hits that cause the immediate concussion, but it's these sub-concussive hits that take a toll over time. I think that's what we're starting to see here. I direct the Brain Health Imaging Center at CAMH, and what we do there is we focus on using PET imaging, which is different than the imaging that a lot of people would know. Most people are familiar with CT scanning or MRI, which give you the structure, whereas in PET we inject a radioactive, almost like a dye, but it's a radioactive drug, and we can visualize the living human brain. We also look at postmortem brains. So that's another thing. When people donate their brains, we're able to look at those using, again, radioactive imaging methods. The biggest thing that we're trying to do right now, and especially with military populations, because on some level, a lot of the people in the military are almost pre-selected in some regard, given the fact that most of them are athletes or have, very athletic in that sense, and also adventurous and outdoorsy, so it tends to attract that crowd of people. So a lot of them have had head injuries in advance, and also in terms of on the job, the exposure, for example, to IEDs and just everyday training. Military breachers are, again, very susceptible to subconcussive hits and shock waves and other head injuries. So we're looking at brain injuries and other mental health consequences. So not just the traumatic brain injury itself, but also things like PTSD, addictions, suicide prevention, major depressive disorder. These are a lot of things that happen once people have had head injuries, that we're trying to understand the many different facets of mental health. So I mentioned in PET scanning, we can look at function. So this is where we try to do these diagnoses and trying to understand the living human brain in addition to postmortem. Again, having the history of the training, backgrounds in contact sports that also couple with these military exercises, it's really not surprising to me that we're seeing more and more people, and also with the increased discussion around mental health, and I think we're starting to see more people coming out and being open about the fact that they can now say, I have a head injury, whereas historically it was just not discussed, and it was more about get back out there, and it's part of the job that you don't discuss it or admit that you have a head injury. Something like Project Enlist, where you ask people to donate their brains, this is important for all facets of mental health. So I think this is an opportunity for Canada to really lead the way.